Hello, I'm Dick Miller, and Jeff Smith, our senator, and I are back together with you, sitting around the table here, and hope to have a few words to say about what's going on in the Wisconsin Senate. What do you think? Are we heading towards spring now, or are we getting close?
We're in spring. It's spring.
Officially.
Yeah, officially it is spring. We are, and with spring of an odd-numbered year, we have introduction of a new budget for the biennium, and fireworks will be coming soon.
Well, you know, the only thing I've heard, and I don't listen to a lot of news, local state news, it seems like, not enough. But the other day I heard that the Republican Party has already found fault with some of Governor Evers' suggestions in terms of the budget. Now, that's understandable, but what are they advocating?
We don't know yet.
They haven't put forth any ideas at all.
Yeah, we don't know yet. And that's somewhat understandable too, because the Joint Finance Committee, which is what they control, will be the next shot at it. And the process is the governor's budget is out there. We are able to talk about what he's proposing, and by the time May rolls around, Joint Finance Committee will have started their process, and they've already promised to throw his budget out, which is what they did 2 years ago as well, which is disappointing. And I'll tell you a lot of good reasons why that's disappointing. And I got a couple numbers I'll just throw at you. You know, one of them is the perennial Medicaid expansion is in that budget, which would provide coverage for another 90,900 uninsured Wisconsinites, and save the state $630 million per year. And on top of that, at the moment, there's an enticement through the latest COVID package that'll, if we were to adopt Medicaid expansion, we'd get another $1 billion into the state. So we're talking $1.6 billion right away if we were to do the right thing, which we're now like one of 10 states that haven't done the right thing and have provided Medicaid expansion through the Affordable Care Act. So that's one thing, and of course they already said that's a non-starter, which I shake my head and think, well, how can we keep turning down our tax dollars? This is not free money. This is tax dollars we send to Washington, and we're instead sending it to other states instead of bringing it back to Wisconsin. The budget, this is just medical parts of it. The budget would cap insulin prices at $50. That'd be good news for a lot of people. Budget invests nearly $200 million to expand telehealth services. And, well, broadband in general, actually. Budget directs $150 million towards critical mental health initiatives, and it invests $600 million in our long-term care infrastructure, which, as anybody in rural Wisconsin knows, we're losing our long-term care facilities all the time. We've lost 41, I believe, have closed in the last 4 or 5 years, and so they need help. We're people like you and I, baby boomers, we're going to be stressing that system out pretty soon, and so we're going to need that, and we want people to stay close to home when they do move into a long-term fair care facility. So I wanted to get those numbers out there because those are important. Healthcare parts of it are really important. But just one last thing again, though, that I even had someone who was up on my road, at the end of my road. He was doing some checking out. This is West Wisconsin Telecom checking out our road because what it would take to run fiber up our road, because they're going to be running down the highway, and they're curious. I don't think it'll happen, and he was not optimistic either, but we were talking, and he even said, if you guys can't come together in a bipartisan fashion for broadband, I don't know what you can do, because everybody agrees that we have to invest in broadband expansion. into rural areas, just like we did with electricity. You've heard me say this so many times, but now here we are at that juncture where the governor has requested $200 million investment into the grant program, and which would be more than double what we've ever invested before. But this past year has definitely demonstrated the greatest need we have right now may be in broadband expansion to every household.
Well, going back just a second to the Medicare, the money that Medicaid that we have, for whatever reasons, have chosen not to accept it. What does the majority party? How do they justify their stand? Have you picked anything up?
Well,
what are their arguments?
Yeah, over the years, it's this philosophy from the Republican Party that they don't take money from the federal government. It's the same reason that the previous Governor Walker handed back that high-speed rail money.
Rail, sure.
Right?
Light rail.
Yeah,
Mm-hmm.
and in fact, actually, there was some broadband. This is 10 years ago. Broadband money that we had fought for and gotten invested from the federal government that he also sent back. That was overshadowed by the high-speed rail part and the Medicaid expansion. Same argument with all of them. Don't they just have a deep down philosophy that they don't accept federal money? And again, it just makes you shake your head. It's our money. It is our money. Why should it go somewhere else? That high-speed rail money, you know where it ended up?
I know some other state.
California.
Yeah, for their light rail.
Yeah, for their light rail.
Yeah.
For their high-speed rail. And so why should we keep doing that? Dick,
Well,
it's hard to understand.
I'm going to throw an argument out and give you a chance to debate it a little bit. When I was working on the local level, on the county level, the thing that always bothered me a little bit about state monies is, and this is local control speaking now, is number one, we get a program going and required to hire staff, buy equipment, and then the money dries up. And the county is limited what we can raise in taxes. As you well know, the state has limited what we can raise. And that's not all bad. I don't mean to be too critical of it. And sometimes the strings attached in terms of controls are a bit of a worrisome thing. Now, are the Republicans speaking along those lines? Are they concerned about the feds decide not to continue the program, or what are they concerned with?
That has exactly been their argument. That's been their argument, but it's an argument that hasn't shown any
merit, so to speak.
It's not happening.
Yeah.
I mean, the Affordable Care Act is here to stay.
Yeah.
I think in their minds 10 years ago, they thought for sure they were going to overturn the Affordable Care Act. That they for sure were, and then President Trump came in here and was so adamant about he was going to overturn the Affordable Care Act, but they never had an answer, right? They never had a plan to replace it. So it's here, it's staying, it's not going away. This is, and over 10 years, can you imagine what we've lost? Because we've been afraid to take the chance. Sometimes, and as you know from local government, you do that because you take the chance because it's a need that needs to be met, and you're serving your constituents.
And I think that's what's happened with the COVID situation. There's been a lot of money coming in, and some of that's going via state to the local communities.
Yeah. Yep.
But it like you say, it supports this idea of local needs.
Yeah.
And I think another part of it you were discussing earlier is support for our residents in nursing homes and those kinds of programs. And I know there's been a lot of movement towards in-home care, which is wonderful. I think we all want to live in our own home. But by the same token, with all of us baby boomers coming along, there'll be a significant number of us that may require nursing care, specialized care. And these people, they are struggling. We all know that.
Yeah,
They
they are.
The money allocated is not enough quite to go far enough to maintain that program.
Yeah, and let's face it. As much as we want to stay in our homes till the day they carry us out, it doesn't happen that often, right? At some point, but particularly if you can. And I always tell the story about my own wife's grandpa, who, when his time came to move out of his house, he was able to move into the Strum nursing home, which if anybody's watching this, you probably know that's closed a long time ago.
Yes, it's been several years ago.
Well, when he was there, his sister worked there, and other former neighbors worked there, and we were able to visit him all the time. And now a place like that is closed. I mean, I use that as an example because we all know what that means. That means if you can't go to a place like that and it's not close, you got to go to some place that's up to an hour away. And it really hurts in many ways. I think it shortens people's lives. They're lonely, and also they just don't have the feeling of home that they have when they have something local. And really back down to the money though. One of the reasons they can't make it, because they got to have some profit to be able to pay their employees, and they're not paying their employees. Their employees can go to Quick Trip and make more money. They can go to Woodman's in Eau Claire and make more money. Why should we? We need healthcare workers. That is such an essential line of work, and we need to pay them. It's hard work. We need to pay them what they're worth, and be competitive, and hang on to those workers.
Well, it's so interesting because that's the same way with caring for children when moms and dads are both working. Who are the lowest paid people in the area, and that's people who are caring for our loved ones, old and young.
Yeah,
no,
it's right. Thanks for bringing that up, because I don't even think we were really. But I just had meetings on early child care as well. It is really basically the same situation. So we've lost a lot of that. And actually, out of the COVID relief money, both in the first package and the next package, there is money for that purpose to support and keep them going. They estimate that if they hadn't passed that package, there would have been at least 50% of our child care facilities, and that's whether they're small or large, would have closed across this country. And how would business survive if they closed? And the business community is figuring that out now too. And I know that for a fact because I'm on a group in Jackson County that's business oriented and coming together and figuring out how they're going to help subsidize and provide and make sure that their employees have that facilities available to them.
They have the option.
They need them. They need their employees at work. And so for them to be at work, their children have to be in a safe place.
Well, not too long ago, the Blair Taylor School Board had a project they took to the voters, and that was to add on to the building to provide some room for daycare, which is it'll be interesting because this is a whole new challenge for the school.
Yeah.
But the problem is, again, working moms and dads and wanting to have someone home when those kids get home, and the good quality daycare or care for elderly is so important. It's so important, and like you say, the wages are competitive out there today.
Yeah.
You have choices.
It's about family.
Yeah, absolutely. Yeah. Anything else, Jeff, that in that budget that comes to mind?
Well, yeah, there's so much, and in fact, you could go to my website, and I just recorded a 45-minute analysis of the governor's budget. I know it's 45 minutes, but you can we have it figured out so you can go to the section you want to hear to most of all. We got in agriculture, he's put $43 million towards agriculture. I mean, every group that has come in and talked about the budget now has said they're really pleased with what the governor is proposing. Really pleased. But someone's going to have their heart broken at some point, and then on a normal basis. But it sounds like everybody's going to have their heart broken unless the Republican Joint Finance Committee comes up with something that is just as pleasing as what Governor has proposed.
So when you say joint, you're talking about House and Senate.
Yeah, so joint finance.
It's not joint Republican-Democrat.
Well, it is. And I mean, it is. It has to have some Democrats on there, but they are in control and they decide how many Democrats and how many Republicans are on there. So if you're curious, it's a 16-member committee and it's 12 Republicans and 4 Democrats. That's how it's made up. And also, April 22nd, they will be at Stout in Menominee, UW Stout, holding a hearing. And it'll be pretty much those hearings are all day. And I'll add one last quick thing on that before we move on to something else. But there's always complaints about policy in the budget. But I'll tell you this, we as Democrats introduce bills and don't get hearings because Republicans just won't do that. That's how politics is working right now. So whether you like it or not, we introduce things into the budget that we would otherwise have as singular bills, and because it's the only place we actually get a hearing, because
In the budget.
it's in the budget. So and you have 4 hearings around the state. So it is the best hearings any biennium. Those are the biggest hearings you get to because they're also out of Madison. And you have an opportunity to talk about the things you care about. Because me personally, I'll be introducing more individual bills after that budget is thrown out because many of the things I want are in that budget.
Thank you for mentioning this. Many times we'll be having discussion and some will say, well, why did they put that in that budget bill? It's just like with the COVID, this bill that was passed in Washington, that happened there. They tried to put various things in there, and they don't seem to fit.
Right.
But the reason you do it is out of necessity, that if it didn't get in there, it would not be heard by the people.
Yeah, and at least you get to have some discussion about it.
It's going to be buried by the whoever the Senate or House majority leader is.
Yeah. I mean, oftentimes there's things I do think shouldn't go into a thing like that, and I agree with that. But now more than ever, I understand why. And I don't think there's terrible, because think of everything costs money.
Sure.
Bottom line, everything costs money. So every decision we make costs money. So in some ways you can argue that it all
fits,
belongs in there, right? One other thing I wanted to mention was we just had a session day few days ago in Madison, and the Republicans are trying to try it in a bill, which will be vetoed by the governor, to take his power away in dispersing the federal money that's coming in.
The oversight.
That's gotten a lot of,
yes.
Yeah, that's gotten a lot of press. But what I tried to do is to just ratchet things back down to what we should be doing together. And that is we still have an issue of unemployment insurance in the state of Wisconsin, and people are still unemployed, and businesses are struggling because of this pandemic over the past year. And if we were to eliminate the 1-week waiting period that the state of Wisconsin has in statutes, which is draconian in my view, we would be eligible for another $2.3 million a week from the federal government to help subsidize our unemployment insurance, saving us money somewhere else. 2.3 million, and so I tried to sub the bill that we were debating with that repeal of that 1-week waiting period. Because if we don't do that, we don't get that money. And it's only till September. I was only proposing till September we eliminate that 1-week waiting period. But I would argue, why do we punish people for becoming unemployed the first week that they're unemployed? It's not like they have a chance to get a job and find a new job that first week. I do not know why we think we should punish people for that first week. I understand a limit of 26 weeks that we have out there. They need to be looking, and then it ends. But why are we punishing people for that first week?
So they basically lose out on a week's pay.
Yeah.
Well, interesting thing is that every employer pays into unemployment insurance.
Yeah.
You know,
Yeah.
and the government is
It's insurance.
it's insurance, and every employer is paying into that
Yeah,
fund.
just like your home insurance. You
Sure.
pay into it and hope you never have to use it.
Yeah, yeah.
Yeah.
You kind of wonder why that was ever put in the law.
That 1 week,
Yeah.
it's politics, Dick. It's politics. It
Yeah.
truly is. It's. Well, I'll tell you, because the response we got from Speaker Voss is, for me, appalling. His response is, well, we think, and he's speaking for all Republicans, which I don't think is fair on to all of his colleagues, because I know they're not all the same. But he does, and he said, I just heard him speak, and he said, we think it's that people. How did he say it? And I'm sorry, I'm going to be paraphrasing, something to the effect that people get lazy and don't want to work because they're getting that money. I don't think Wisconsin families and workers are lazy. They are not lazy. I've worked in Wisconsin my whole life. My knees, we're talking about, my knees are shot because I worked hard, and I know other people the same way. We are not lazy. And for him to say that, I think, is insulting and, again, and mean-spirited for someone who himself has taken $298,000 from the first COVID package for his own popcorn factory. $298,000 he took of PPP for his factory, a popcorn factory, but he thinks people are lazy and so he doesn't want to pay them. He doesn't want them to collect the first week of unemployment.
Yeah, the bulk of the people that I've talked to over the years really would rather be working.
Yes.
You know, number one, it's the benefit of not just the monetary benefit, but it's obviously the social. It's a lot of other things, and most in the past, unemployment did not meet what they were earning
No.
when they were gainfully employed.
And this is only, and you're right, and it's only that way now because we know that an epidemic is a pandemic. Businesses closed temporarily, mostly, I hope, some of them permanently, and it is at no fault of the workers that happened, and they should be able to pay their rent, and they should be able to get groceries for their children, and they should be able, to cover their costs. And so federal government says we're gonna pad your usual unemployment with this amount of money so that you can do that while we get through this terrible epidemic.
Well, if I remember my history, unemployment came into existence after or during the Depression years. That there was a safety net for those that were struggling.
Yeah.
And
So keeping in mind what you said earlier, it's insurance. We put money into it. It's not money that is even coming out of your taxes, really. It's just like Social Security is, like Medicare is. It was programs that were developed, during the last century, of having this pot of money that was there for emergency use, so to speak, or when you retire. But it's putting money away, and then you use it when you need it. Insurance.
And I think if we all look at it as insurance, because none of us are going to turn away from receiving insurance when we earn it out of whatever, bad weather takes our roof off our house and so forth. It's something we've put money towards. I want to get to something else here real quick. This morning, listening to the news, they were talking about the bills that were just recently signed into law in Georgia, and regarding restricting, I will call it restricting one's right to vote. I'll call it what it is, I think. What's happening in Wisconsin?
Much of that, what you saw in Georgia, has been introduced here. And I just got a notice yesterday. I am actually ranking member on elections committee, and Senator Bernier, the neighbor, she's the chair of that committee, and she noticed us that we're going to meet on April 7th and again on April 15th to hear those bills' public hearings. And brace yourself, right? This is going to be ugly, I mean, in my view. I mean, to restrict the ability of citizens to vote is maybe one of the worst things we can be doing in this country to our democracy. And I don't know how it's happening that people are becoming convinced that that's something we should do. You know, and similar to what happened January 6th. What's happened to this country that we don't accept when we lose an election, and so we want to destroy the process. I mean, we've all gone through. I've lost elections personally, right? You accept that. People I voted for have not won often, and I accept that. But when people win that I vote for, I'm happy for that. But you know, I don't gloat because I know the next time around it can go the other way, because that's the country we live in. We have this privilege and this ability. Now, I shouldn't say privilege. We have this obligation to vote and keep that democracy that was founded 250 years ago alive. So I'll be fighting this attempt to suppress votes.
Well, you know, maybe one way to look at it is that if there's a move to somehow keep people from the polls, how can those who maybe aren't affected by that move, how can they not think, are they next to lose their vote, the ability to vote? You know, this idea of restriction, I guess, I have to say it angers me. That we should be applauding an effort to get people to come out and vote. You know, we've complained for years. We don't get enough people out to vote. Well, we start seeing them, and all of a sudden, it's not good.
We had a record turnout, you know, and of course people question that. No, we had a record turnout because certain things had to happen because people couldn't safely go to the polls. Some didn't feel safe doing that, so we gave them more flexibility to cast absentee ballots. And when we did that, people voted. Oh, that's a good thing. That is a good thing. So let's keep it up.
Okay, we're going to have to wrap it up here. I do want to encourage everyone who sees this ahead of time, get out and vote April 6th. We have a primary in this state. Please vote, and thank you.
And get your shot when your time comes. Get your shot.
Good day.